Hello, my name is Martin Lipscomb, and today I'm joined by Professor Dan Zahavi. Dan is simply at the present time one of the most influential and interesting scholars writing on phenomenology. Professor of philosophy at the University of Copenhagen, where he's director of the Centre for Subjectivity Research, and also Oxford University, where he's a senior fellow at St Hilda's College, Professor Zahavi has received a raft of awards. He has published over 25 books, a staggering number of papers, and his work, Wikipedia says, has been translated into over 30 languages. Professor Zahavi's interests include, but are not limited to, correcting misunderstandings about the work of Edmund Husserl, and more generally, investigations pertaining to the philosophy of mind. Now, shamefully, I've only recently come to Dan's work, and for anyone like myself who's curious about phenomenology and would like to know more, his Phenomenology, the Basics, is a stimulating introductory text, and having read the basics, I can also wholeheartedly recommend Husserl's Phenomenology. Now, I've asked Professor Zahavi to talk about the Phenomenological project. More specifically, what were the problems or issues that philosophers such as Husserl and Heidegger considered important, and further, what insights did they bring to these problems? Now, Dan has pointed out this might easily take us off into interesting but perhaps philosophic backwaters, and wisely he suggests restricting comments to ideas which possibly nurses might not realise that they need to understand when undertaking phenomenological investigations, or just understanding their work environment. So, Professor Zahavi, please, what was and what is the Phenomenological project? What problems did Husserl and Heidegger and the other big beasts consider important, and how did they attempt to unravel these problems?
Thank you so much, Martin. I'm really appreciating this opportunity to be able to talk a little bit about phenomenology. So, I mean, to start with the start, I mean, we are really dealing with a philosophical tradition that has 120 years in its back, and it is considered to be one of the most influential philosophical traditions of the 20th century. Among the people, I mean, you mentioned Husserl and Heidegger. I guess other kind of influential figures to mention that might also be known to nurses would include, for instance, Edith Stein on empathy. There's Sartre, of course, Merleau-Ponty, with his focus on embodiment, and kind of more recently figures like Levinas and Ricoeur. And of course, there are lots of differences here. They didn't all, by any means, agree on everything, but I still think it makes sense to talk about phenomenology as a somewhat unified research program or project. And what I want to try to do in the following is to highlight what I take to be some of the commonalities. Now, I think one reason why phenomenology very early on was very enthusiastically received, not just within philosophy, but actually also outside of philosophy. I mean, actually quite from the very start, it was picked up, for instance, by psychiatrists and experimental psychologists. And I think one of the reasons why it had that kind of impact was because phenomenology was seen by many to differ from other philosophical schools by somehow linking up with and trying to address problems that we kind of recognize from our everyday life. And one way to try to specify what might be characteristic of the phenomenological kind of focus is by very briefly comparing, how a phenomenologist would approach and investigate an object in contrast to how a natural scientist would do so. So again, very bluntly put, I think what phenomenology is interested in is in the question of how objects appear rather than in what they are. And so, whereas a natural scientist, for instance, if investigating a bottle or a cup or a desk, might be interested in the chemical properties, the quantitative features that these objects possess. So how heavy are they, how solid are they, how expensive are they. The phenomenologist would be interested in how these objects appear to us and how we experience them. And so, again, to take a very, very simple example, if we're looking at a a bottle and investigating how a bottle appears, I mean, some of the features that the phenomenologists would point to would be the fact that a bottle appears perceptually. We don't simply think about the bottle. When we look at it, it's perceptually present. It appears perspectively. We cannot see all of the bottles simultaneously. We can only do that if we move the bottle, or if we ourselves, as embodied actors, move around the bottle. The bottle also has a certain temporal duration. It appears with a certain practical significance. It is graspable. It affords drinking. And so the point is that by investigating all these different dimensions, the phenomenological philosophers eventually was able to offer a more comprehensive account of human existence, an account where human beings are basically seen as embodied and socially and culturally embedded beings in the world. And what I want to do now is basically to highlight or try to explain some of these core notions that the phenomenologists came up with by effectuating the kind of very basic phenomenon analysis that I have just tried to exemplify in a very brief manner. And I want to highlight 5 different notions and basically take them one by one, and then I have some final kind of concluding remarks. But the five notions, just to give you a head up on what I want to talk about, is intentionality, the lived body, temporality, the life world, and empathy. So intentionality is definitely one of the key notions in phenomenological philosophy. What does it mean? It basically refers to the fact that consciousness is conscious of something, that consciousness is about something. It basically highlights the way in which human subjectivity and the world are interlinked, and to what extent both of these aspects, our experiential perspective on the world and the way the world appears to us, have to be investigated in tandem. So again, to take one of the classical examples, the point would be that if we want to understand what it means to be conscious, if we want to understand what it means to perceive something or fear something or hate somebody or remember something or imagine something, well, then all these different intentional acts, all these different types of conscious states, they all have or take an object. They are all self-transcending in the sense that what they basically point to is the fact that the human mind is not self-occupied or self-concerned, but is very much related to and open to the world in which it finds itself. And what the phenomenologists would say is that all these different all these different types of intentionality, again, fear, hatred, perception, imagination, recollection, and so forth, they each have different structures. They each feel qualitatively different to the subject that are experiencing them. And part of the phenomenological task has then been to try to understand how these different types of intentionality are related. And again, one basic proposal has been that perception, our perceptual encounter with the world, has a certain primacy. It's more fundamental, more basic than, say, more intellectual, theoretical speculations about the world. And so this is, for instance, why Merleau-Ponty would talk about the primacy of perception. But again, a fundamental idea is that consciousness is not concerned with itself or preoccupied with itself, but open to the world. And phenomenology is very much about investigating this link between the mind and the world. What then about the body? And here I think one of the central phenomenological ideas is that if we want to understand the body, it's not sufficient simply to investigate the body as it is explored in physiology or anatomy, namely simply as something that can be described mechanically from a third-person perspective. If we want to understand what the body is, we also need to consider the way it's lived through subjectively. We need to to some extent, I mean, one way to talk about it would be to say we need to consider the difference, but of course also the relation between the body as an objective object and the body as something that is subjectively lived through. And the main idea that the phenomenologists would defend is the idea that the body is not really just a spatial object in the world. The body is also what allows us to engage with and understand the world. It's what allows us to have a perspective on the world in the first place. Body, so to speak, constitutes our point of view, it constitutes our point of departure, and it affects how we experience objects, how we experience other people, and how we experience ourselves. And perhaps one way to highlight these different dimensions would be by considering how we would experience a chair if we weren't embodied, or how our self-experience would be transformed if we weren't embodied. I mean, gender, age would somehow not factor into our self-experience. And finally, how could we ever understand other people if we didn't take, our point of departure in something as crucial as the face-to-face relationship? Now, one way to kind of cash out the importance of this notion of the lived body for clinical context would basically be by considering how to understand bodily impairments, for instance, a case of amputation. And so I think what the phenomenologists would say is that, amputation is not just about losing a body part in the sense that one then ends up with a less than optimal body machine. It's not just about the body now having fewer motoric skills, for instance. No, losing a body part is also about undergoing a radical transformation of the way in which one interacts with and understands oneself, the world, and others. And to just take a couple of examples, I mean, imagine a long-distance runner who loses her right foot. I mean, that person is not now simply faced with the problem of being able to move less efficiently. It's also about struggling with the task of redefining who she is, since being a very passionate runner, I mean, being able to run has been what partly defined her life and her character. So for her, coping with the amputation is also about having to reconsider her own identity. Another example would be somebody who, for instance, is placed in a wheelchair. And again, that person is not just now faced with the problem of having fewer bodily capacities. Assume that he is living in a house with a basement, where the basement used to be a favored place to relax and perhaps enjoy a book. Now, for him, the whole home environment has, of course, changed, since that basement that used to be a source of relaxation is now suddenly inaccessible due to the fact that he's bound to a wheelchair. So it's not just about, again, having fewer bodily skills. It's also about the environment in which you are living suddenly changing its character. And again, just a final example. I mean, consider a teenager who loses his left hand. Again, this is not just about suddenly lacking a body part. It's also about now being forced to renegotiate the social space that the teenager is situated in. It's about facing up to his peers and the kind of recognition and acknowledgement that they are either providing him with or depriving him of. So again, in order to understand what it means for a certain person to have these amputations, I mean, again, it's not enough just to look at the physiological dimension. There's so much more that has to be investigated. And I think that, the phenomenological exploration of embodiment can be very helpful here. Then temporality, I guess one of the points that the phenomenologists have been focusing on here is that we should make a difference between what might be called clock time and what might be called lived time. So if we look at the clock, I mean, at least a traditional one, I mean, there is this idea that the now is wafer thin. There's the idea that time has a uniform tempo. It goes, I mean, it has the same speed regardless of what. I mean, you basically just look at the pointer of the watch. It's unidirectional. It's always heading towards the future. And all temporal points have equal value. I mean, there's no point that is more significant than others. So this is one way to talk about time, the time of the clock. But what does that have to do with time as we experience it? I mean, the now that is experienced is not a wafer thin now. It's an extended now. It makes perfect sense to talk about a now with a temporal extension or duration. I can say that I'm currently having a conversation with somebody right now, and what I mean by saying that I'm having the conversation right now isn't that I have a conversation that is wafer thin. Of course, the nowness or the presence I'm referring to has a much longer duration. The speed of time, when we are looking at how we experience time, is also something that can accelerate and decelerate. Again, just compare the experience of sitting in a cinema and watching a movie that you either find extremely fascinating or extremely boring. I mean, I think your experience of time will differ, even though it might be the very same 2 hours that the movie lasts. The lived time is also multi-directional. It's not just about heading towards the future. I mean, very often we also remember and recollect and dwell in the past. So there's a kind of constant reliving of the past that is very much part of our normal human existence. And of course, there are also some temporal episodes that are far more significant than others, depending on their relationship to the experiencing subject. So the idea that all temporal points have equal value, again, might make sense from the perspective of the watch if it had one, which I kind of doubt. But given the moment we think about time as something that is experienced, I mean, this uniform equality is really must be considered an abstraction. And what is the relevance of all of this in a clinical context? Well, consider the fact that a patient, for instance, who is waiting eagerly for his or her diagnosis might experience that waiting time very differently from other people. I mean, might be perhaps more impatient. And another case of impatience might be somebody waiting to see the doctor while in excruciating pain. I mean, I think also pain obviously changes our experience of time in significant ways. Or think about somebody who has just received a diagnosis, but one which is very severe. I mean, where, for instance, the doctors have said, you have 6 months left to live in. I think for that person, again, the planning of time, the consideration of what there is time for is also something that has to be reconsidered. And again, just thinking about time as a clock time is simply not able to capture these existential differences, if you will. Then there's the notion of the life world, which can also be considered a kind of umbrella term for many of the things I've already addressed. So what the phenomenologists are referring to when talking about the life world is basically the world we live in, the world we take for granted in daily life. Now, what kind of world is that? It's not a world consisting of neural circuits or chemical compounds or neutral quantifiable entities. No, it's a world consisting of objects that we know and care about, tables, books, newspapers, trees, objects that in various ways are given either as interesting or useful or out of reach. It's also a world populated by other people. I mean, we are social creatures, and the world we inhabit is very much populated by people whom we encounter as relatives, colleagues, competitors, enemies, etc. Now, the life world is also one that is structured by references of use, bodily dimensions, pragmatic concerns. So it's very much a subject-dependent world filled with subject-related meaning. That is the world we know. That is the world we care about. That is the world that we find ourselves at home in. And of course, it's also this world that precisely is filled with kind of lived time rather than the mere abstraction of the clock time. It's also a world that very much is influenced by, again, by the kind of bodily, I mean, which kind of affords different possibilities also depending upon our bodily skills. And so again, I mean, to just give an example, I mean, just to refer back to the example I gave a moment ago with the person bound in a wheelchair, I mean, so that person will no longer experience the world, I mean, the basement below as accessible. If you are, if you are a child, I mean, a big chair might also not be seen as sittable because it has dimensions that don't fit your own bodily dimensions, and so on and so forth. Then the final kind of notion I would just briefly talk about is empathy. Now, what makes the notion of empathy and the discussion of empathy quite complicated and confusing is that a lot of people are, I mean, where some of the other notions are kind of distinctly phenomenological, if you will. So, the notion of life world, the notion of lived body is very much notions that are linked to a phenomenological discourse. The notion of empathy is, of course, used in a lot of different contexts with a lot of different meaning, which kind of makes it a bit complicated to talk about, since people often actually mean different things when they're talking about empathy, and so it's very easy to talk at cross purposes. So for some, for instance, empathy is a form of sympathy. It's pro-social, involves some kind of compassion. That's one proposal. Another proposal would be that empathy is about kind of affective sharing, a form of emotional contagion. It's about coming to feel what other people are feeling. Now, interestingly, though, the phenomenologists were among the very first kind of theorists to address the problem of empathy, and they were kind of thinking about it in a somewhat different manner, but in a manner that I think also had clinical relevance. And I'll come back to that in just a second. So what the phenomenologists mean by empathy is basically a specific form of interpersonal understanding, which is characterized by its immediacy, its intuitive nature, its embodied kind of foundation. So, I mean, compare the following two situations. I mean, that might be one way to kind of cash out what they have in mind here. Compare a situation where you're visiting a friend, he's not at home, you enter his workspace, and then you see all the letters from his ex-wife having been torn to pieces and scattered all around the room. And on the basis of these findings, you then infer that he's probably upset about his divorce. So that's one way, that's one type of interpersonal understanding. It's kind of theory driven, and it's based on, and it's inferential. Now compare that to you standing face to face with your friend. You ask him how he's holding up, and then he basically breaks down in front of you, and you can hear in the tonality of his voice and see from his crying how upset he is. I mean, this is of course also a form of interpersonal understanding, and it kind of gives you reach the same conclusion, if you will, as in the previous case, because you also now understand that he's upset. But of course, the way you do that is very different from the way you did that in the previous example. And for the phenomenologist, this way of experiencing the emotions, the intentions, the feelings of the other in his or her bodily behavior and bodily expressivity is precisely what they mean by empathy. So empathy is really for them the kind of interpersonal understanding that you find in the face-to-face encounter. And it's not about fusion, it's not about projection, but rather it's about focusing on and appreciating the experiences that the other is going through as his or her own experiences. What is the clinical relevance of that? Well, let me give you an example by pointing to something that is called the disability paradox, which is basically this paradox that there is it has been observed that there sometimes is this mismatch between the assessment of external observers when it comes to the quality of life that people with severe disabilities have. I mean, so how do external observers assess these people's quality of life compared to how the people themselves are reporting their quality of life, if one bothers to actually ask them about it? And I mean, one kind of salient example here is people with locked-in syndrome, that many external observers would suppose would be having absolutely terrible lives, and where one might perhaps even one might even be prepared perhaps to propose some kind of end-of-life treatment, because one imagines this to be something like the worst possible condition one could possibly find oneself in. And what is, of course, perhaps surprising is that if one then actually speaks with people with locked-in syndrome, after the initial kind of phase of total bewilderment and desperation, and after reliable channels of communication has been established, well, then the patients actually can report very meaningful lives, high quality of life. I mean, one can even come across first-person reports where the patients are saying that this is the best that has ever happened to them, because it has forced them to completely reconsider their priorities in life, which again is a very surprising statement. But the point here is basically the following. Why is it that some external observers have these totally mismatching assessments? And I think one plausible explanation is that when these external observers are faced with the question of how is it for this patient, well, then they will often employ some kind of projective what is the word now? A kind of projective mechanism or procedure. So they are basically asking themselves, what would it be like for me to be in that person's situation? And I'm not saying that kind of imaginative perspective taking might not in some cases be relevant, but there is of course a danger that you ultimately basically just end up projecting your own preferences onto the patient that you are trying to understand, thereby completely eradicating or dismissing the patient's own view and perspective. And I think this is where something like empathy might be relevant, because again, what the phenomenology would keep insisting upon is that empathy is all about really trying to address and preserve and respect the otherness of the patient's perspective, rather than imposing one's own perspective upon the patient. Okay, now I'm kind of coming towards my end now, so let me just try to wrap up and ask the question of, what might all of these ideas that I have been presenting, I mean, why might they be of interest to nurses? And of course, I mean, as hopefully most of you will know, I mean, many nurses have been very interested in and continues to be very, very interested in phenomenology. And in one regard, I guess the answer is fairly straightforward. I mean, Phenomenology is interested in and has a lot to say about subjective experiences and the way in which it is important for our self-identity, our social interaction, our way of engaging with the world. And insofar as nurses are interested in the experiential claims and concerns of the patients, I mean, there seems to be a kind of perfect match here. And I guess to some extent one might say, well, if the aim is to provoke proper care for, say, stroke patients or patients with diabetes, or patients with locked-in syndrome, well, then it does absolutely seem pertinent to try to understand the meaning that people attach to the events that disrupt their lives. And it's important also to understand what it's subjectively like to live with such conditions. So this is what at first at least seems to make nursing practice fit very neatly with the phenomenological approach. The problem is merely that that there are also some challenges in kind of making use of phenomenological philosophy, because this is what it ultimately is in a kind of clinical context. Because how exactly is one supposed to do that? I mean, should one then read all these figures that I mentioned in the beginning? I mean, read Husserl and Heidegger and Stein and Merleau-Ponty and become very familiar with their theoretical work? I mean, is that the way forward, or might it perhaps on the to go to the other extreme? I mean, might it perhaps just be sufficient to just show a certain interest in the experiential life of the patient, and that's then that, I mean, if you do that, then you're already kind of doing a kind of nursing phenomenology. And I think that my proposal here, and perhaps this is something we can also take up in the conversation afterwards, I think it's very important not to trivialize what phenomenology has to offer, and simply to assume that it's enough that if you simply ask the patient, well, how are you? Or how do you feel today? I mean, that and thereby showing a certain interest in the experiential life of the patient, well, then you're already kind of doing a kind of phenomenological care. I mean, I think that's just not, that's simply not sufficient. Obviously, it's not enough just to understand what the patient is experiencing here now, say, how intense is your pain? I mean, what you also ought to be interested in is, what kind of sense making is the patient? I mean, how is the patient coping with the condition he or she is finding him or herself in? How does it affect and change and transform again his or her own understanding? And then just stick to one pronoun, it's getting too complicated otherwise. I mean, how is he understanding? How is the condition he's having affecting his self-experience? How is it going to transform his engagement with the environment, depending on what kind of environment he's finding himself in? And how is it going to change and transform all his social life? I mean, this is also what you need to be concerned with. And in order to try to understand that, I mean, I think that phenomenology can actually offer some help precisely by outlining the kind of notions I have been presenting. So, I mean, the notion of the life world might be important. How is the life world of the patient changed as a result of the specific condition that the patient is living with? How is it affecting his lived body? Not simply looking at, say, the physiological parameters here, but to what extent does it, say, transform his way of engaging with others, his self-experience? And so I think that my proposal would really be that if one wants to make headway here as nurses interested in phenomenology, there are kind of certain dangers that one should avoid. So first of all, one should avoid a too trivial use of phenomenology where it's simply about showing an interest in the patient's experiences. I don't think that's sufficient. I also think one should avoid the opposite danger of a kind of hyper-philosophizing, where one thinks that one has to kind of learn by heart everything that is of philosophical value in the work of the philosophers and apply that in the clinical context, because there are a lot of, I mean, the philosophers we are talking about, I mean, they did not write their works for nurses, and they had a lot of other concerns in mind that had absolutely no relation or relevance for nursing. And why start drawing on those concerns when trying to help patients? And finally, there's of course also a very important question about the method. Phenomenologists have been talking about a specific philosophical method, and I guess one important question is whether the method that the phenomenological philosophers are using to do philosophy is also the method that the nurses have to employ when wanting to use phenomenological ideas in their clinical practice. And I'm somewhat skeptical about that idea. So I think that the best way forward is really to try to use some of the, for instance, some of the concepts I've been talking about today. And I think that really the guiding line here should be, will the use of these concepts make a relevance for the patient? And if the answer is no, I mean, then you should stop doing it and do something different. I mean, so the legitimacy of using these ideas, of course, have to be found in them making a clinical difference. And a final, just one final comment. I mean, talking about how phenomenology can be applied in a nursing context is of course an instance of a more general question, namely how do you apply phenomenological ideas in domains that are not per se philosophical. And here I think it's kind of interesting, and for me also a little bit surprising, that the majority of nurses seem to have very much been looking at their own domain in isolation from other domains of application where phenomenology has also been used. And I mean, there are a lot of, I think, very strong and forceful cases in the 20th century where phenomenology has found application. I mean, anthropology might be one explanation, one domain, sociology, psychology, psychiatry, which is perhaps one that is particularly close to my heart. There's a very long tradition for phenomenological psychiatry. And I think there are lots of insights in these other domains of how to use phenomenological ideas in a productive manner that I also think could be, I think, of great relevance for nurses interested in this question of how best to practice phenomenology in the clinic. So.
Dan, that was really, really interesting. Thank you. There are lots of questions that I would like to ask, and I'm aware that my questions might and probably will reflect my own naivety about phenomenology. I agree, if I've understood you correctly, with your last comments that nursing often tends to look within itself too much, and I think we need to open up and see what other people are doing as well. But let me ask you just a couple of questions from all of those that come tumbling into my head at this moment. In Husserl's Phenomenology, you write about the life world, and you, I think, make a distinction between the life world and the ideas which coalesce around that, and how those ideas can be thought about as intention with the scientism, the use to which, or the ways in which people think about science, and the remit of science. Now, in nursing practice, in clinical practice, of course, we want nurses to, for example, embed themselves in evidence-based practice, which can be interpreted in many different ways, but nonetheless is often science-heavy for obvious and sensible reasons. So there is a tension, isn't there, between some of these philosophic ideas around, for example, life world, and the way that they will play out in practice. Is that a fair comment, or is that unfair?
Well, no, I don't think it's unfair. But of course, one question might be, that if there is a tension, well, who has the problem then? I mean, that might of course be the interesting question, because you can find scientists who, and I'm not saying that is the kind of standard, that would be the kind of standard situation that nurses might encounter. But you can of course find scientists who would ultimately argue that the world we are familiar with in everyday experience is basically not real. I mean, if you want to understand what reality is ultimately made up of, I mean, then you basically have to give descriptions only featuring the kind of elements and properties accepted by, say, physics. And I think that is a very austere way at looking at our world. And I mean, one question is whether that kind of scientific worldview, I mean, whether that has any relevance in a clinical context whatsoever. Because I mean, if you really buy into that idea, I mean, it's kind of hard even to recognize or find place for something like human experience and patience, and even a clinical environment. I mean, I don't know how a physicist would even try to address something like a clinical environment. So the problem would be, if there is a tension here, I mean, perhaps the problem is the problem of the scientists, because what they seem to basically want to eradicate from what they consider to be part of reality is everything that actually matters and has significance for us. And here I think that the nurses would do good in actually insisting on respecting and respecting the relevance of the life world. Now that is of course not to say that the life world would necessarily always overrule or trump anything kind of coming from science. So there might be, of course, plenty of situations where one would then have to adjudicate, descriptions being brought in from very different kind of theoretical perspectives. But I think that's the task, rather than, viewing the existence of attention simply as, indicating the failure of the kind of nursing project. I mean, I think that would be the wrong conclusion to draw. I mean, so again, I've kind of been repeating myself a little bit here, but I really think that if there is a tension, it's just as much a problem for the scientists, because I think that a clear desideratum of a scientific account is that it actually enables us to explain the phenomena that we are encountering in everyday life. It's not supposed to, eradicate them or deny their existence. I mean, I don't think that's I don't think that would qualify as a very successful scientific explanation.
Only, so I came to your writing because I was interested in Gadamer, and I wanted to try and understand where Gadamer's ideas came from. And of course, Gadamer, in emphasizing, repositioning the value, part of what he was doing, of the human and moral sciences, fits in very neatly with this idea. And I was very surprised to see how much of Gadamer is found within Husserl. You also mention in the Husserl book, Husserl's Phenomenology, you emphasize the ethical dimension in this type of thinking, phenomenological thinking. And you say, to quote, the phenomenological attitude is not a neutral, impersonal occupation, but a praxis of decisive personal and existential significance. This is a big claim, and it's one which I haven't seen given prominence in some of the nurse writing on phenomenology that I'm familiar with, this ethical dimension. Would you say a little bit more about that?
Yeah, sure. I mean, I mean, it's kind of interesting actually that ethics actually played a bigger role. I mean, because often Husserl, I mean, for those who might have some kind of prior knowledge about him, I mean, he's often viewed and presented as this very dry theorist who are primarily interested in very kind of theoretical questions, and he's then often contrasted with some of the later phenomenologists who are more concerned with more existential aspects. But it's kind of interesting that Husserl not only, I mean, kept giving lectures on ethics, I mean, throughout his entire career, and I mean, as the I mean, there has been a lot of posthumously published lectures and manuscript that has come out, and I mean, currently there's much more material available than there used to be, say, 40 or 50 years ago. So people's appreciation of Husserl's kind of philosophy has also changed as a result of all this new material coming out. Now, what does he have in mind when he talks about the phenomenological attitude having a kind of existential or ethical significance? I mean, I think that specific quote, I think, must be seen in the context. I think there's a specific historical explanation for that, because I think Husserl made that claim after Heidegger had kind of come on the scene with Being and Time, and kind of really presented his own version of phenomenology. And I think Husserl was to some extent trying to say, well, some of the ideas that people are very enthusiastic about in Heidegger's work, I mean, this issue of something being of existential relevance is actually something that you can already find in my own work. So I think there's this historical kind of context that one has to be in mind. But what is it then what does he mean by it? And to some extent, I mean, I think that I actually don't think it's such an unusual idea among many philosophers. So the question is, why do you do philosophy in the first place? And of course, when Husserl talks about adopting the phenomenological attitude, what he really means is, what is it that happens when you start philosophizing in a phenomenological manner? And that's what he basically means. And what I would want to say is, for many philosophers, of course, doing philosophy is not really, an 8 to 4 job, something you do and then you kind of, switch off your philosophical outlook and then start engaging with stuff that really interests you. Of course, I hope I'm not just projecting my own way of looking at things, but I would assume that many of the classical big figures in philosophy, I mean, just think of Socrates, for instance, of course, have had this idea that to do philosophy is to some extent, what makes life worth living. And so starting to do philosophy is also something that doesn't leave your kind of fundamental character untouched. It's really something that is supposed to change you in significant ways. And I think that what Husserl primarily had in mind, and here I think the fact that he's to some extent standing in the light of the Enlightenment tradition comes to the fore, because what for Husserl is very important is basically philosophy as a form of criticism. The fact that you're supposed to criticize dogmatism, you're supposed to lead a life based on evidence. I mean, perhaps he has a slightly broader notion of evidence than the evidence-based medicine and that kind of evidence, but the idea that you should act and make decisions on the basis of insights that you have kind of critically scrutinized is, for Husserl, I think, a very important dimension of what it means to lead an ethical life. And so I think that is basically what he means. And perhaps just one important point that I would also like to add is then the following. Because leading this, Husserl also talks about leading a self-responsible life. And what is kind of interesting is that Husserl is very clear that this is actually not something that we are supposed to do in isolation. I mean, we are supposed to lead this self-responsible life in conjunction or together with people from our community, and we are supposed also, I mean, there's a certain moral duty in trying to let them, to kind of urge them to lead a self-responsible life, and you're supposed to also, they are supposed to help you as well. So I think one can see this notion of an ethical, self-responsible life, again, not as a solitary kind of project, but really as something that we as a moral community is supposed to do together. And I think Husserl was kind of quite clear about that.
Dan, that seems a good place to conclude. Thank you very much for your time. It's been a pleasure listening to you.
My pleasure. Thank you.